Sophia's great. She was diagnosed July 30th of 2015. She did 5 rounds of chemo. She did excellent through all of her chemo. She had a great, complete response from her chemo. She did the stem cell transplant just 2 or 3 days ago, and she is doing great. You would never know. She's a happy-go-lucky little girl. She's just happy to be alive.
I think it's really important because it's like a chance at life, you know. It's great, and it's just amazing that doctors can do this, and it's amazing.
The first few weeks were the hardest because we didn't know what to expect. Neither of us knew anything about chemo or stem cells or cancer, really, in general. We had no idea. After the first round of chemo, we saw how she responded, and she did well. She'd never changed her attitude. She's, like I said, she's a normal 2-year-old. If you didn't know she had cancer, you wouldn't know.
If she's having a good day, then we're having a good day. And I would say 90% of her days are good.
Good days. The more research, the better. You know, they've done tons of research in the past, and all that research that they've done in the past has got them to where they are today. And where they are today is helping us right now, and it's really getting us where we want to be. I mean, I think all the research that they've done is making Sophia's treatment easier. Their ultimate goal for Sophia is a cure. Her cancer is curable. So in the end, the goal is to be cured.
You just don't know until it happens to you. Like, it doesn't hit home until it's your child or somebody you know.
Our doctors are great. We have the best doctors that we could have ever asked for. We have the best team, the best hospitals, and they are doing the best that they know how. And I'm positive, I'm 100% sure that when our treatment is done, that she will be done, and the doctors will have done everything that they could, and to their best abilities.
Our foundation in how we treat cancer now has been based on research. And although we do really well at curing and treating our patients today, we are far from curing everybody. And our commitment to our patients that we can't cure is research. So research is the answer for tomorrow. And so when I heard about the moonshot, about investing in teams of researchers that could accelerate the course of discovery, is truly exciting, because at this point, although we do well, we are far from treating every patient. And this allows us to have a renewed hope that those answers will come sooner than later.
That's the whole goal of research, is not only to find those near cures, but to make the cures that we have more palatable for patients and their families. There's a lot of toxicity and problems that people experience from the current therapies that we give. So being able to address those through research and find ways of making these diseases go away without all the toxicities that come with it would be amazing. And I think that when the president was talking about a moonshot, I think it's a great analogy. Back in those days, people were thinking outside of the box, and it wasn't a political issue. It was something that we all said together, this is important. I think cancer is exactly like that. People need to think outside of the box. Teams need to be developed, multidisciplinary approaches, and it can't be a political problem. Cancer is a problem that everybody knows somebody who's faced this disease, and so we all need to get involved together.
To be able to treat and understand cancer, it's going to take the village, it's going to take the community, it's going to take the government, it's going to take the private sector, it's going to take all of us working together to cure this disease. And that is, I think, a very important message.